We're going to talk about the plasma membrane, which I would argue is the most important organelle for understanding how anatomy and physiology works. So if there's a video to watch before you take this class, I highly recommend watching this one. So let's get started. If we're thinking about the plasma membrane, it's composed of two major components. We've got our lipids and we've got our proteins. We'll start with the lipids, okay? So for the lipids, the main lipid that we think of is our phospholipid, okay? So we have our phosphate, the head, which contains phosphate, and then we've got our tails. And what you'll notice is it makes this bilayer, where the hydrophobic side is internal and the hydrophilic side is external, right? Because our bodies are mostly water. But again, if you're hydrophobic, you are scared of water, so you are to hide from the water. So these tails sit on the inside, and then the heads sit on the outside because they like the water. And this kind of creates a barrier of what sorts of things can get through, right? Most of my area is going to be hydrophobic. So a hydrophilic item, so anything, larger charge, is not going to be able to get in. So if I had a larger molecule that was philic, it's not going to be able to get through. Whereas a hydrophobic molecule could get through. However, this isn't entirely possible when it's too large, right? So I have a large molecule, it's not going to be able to fit in through all this dense space, okay? So how can these larger molecules get in? This is where the proteins come into play. So a good example of a protein, right? We've got this membrane protein. I'm going to show it embedded in the membrane. So I'll draw out the rest of the membrane here. It's got all of our tails. So we have what are referred to as these integral membrane proteins. And these integral membrane proteins can do a lot of things, but one of the main functions that we talk about in anatomy and physiology is the ability to take these larger molecules, these hydrophilic molecules, through the membrane. So they're going to allow for these molecules to be able to get through, right? So things like sugar, things like ions, right? Those things normally can't just get through the membrane on their own, so we can use them. In anatomy and physiology, we learn about the structure of these channels that allow for them to get through. Some are going to be really simple, some are going to be a little bit more complex in how we regulate them. We'll talk about those in some other videos. There are a couple other components of the plasma membrane that are pretty essential. A big one is another lipid that we refer to as cholesterol. So we got our little buddy with 4 rings. We've got cholesterol. And this isn't quite to size, but cholesterol kind of can wedge itself into those phospholipids tails, and that kind of jostles them up a bit, and that changes the fluidity of that tissue, or rather of that membrane. And this can become really relevant when we're thinking about how much we're absorbing, how much we're secreting, the rigidity of that cell, because some of them are going to need more structure, some of them are going to need more fluidity. The other thing when it comes to proteins is we do have some proteins that are peripheral. These peripheral proteins are going to be able to do all sorts of things like signaling, transport, and even cell-to-cell connection. Again, overall, these all work together to be able to allow the correct things into my cell, the correct things out of my cell, and just overall make sure that we have the right barriers and the right signals so that the cell is doing the job that it needs to be doing.